There has been nothing typical about our days since March 7th, when we first had our first COVID patient here. It's been crisis management from the get-go.
One of the things that happens in a crisis, as has been demonstrated through history, is when you're in the middle of a crisis, you become unbelievably creative and innovative. So things that you didn't think you could do prior to a crisis, you end up figuring out how to do it and do it quickly during a crisis. This was an extraordinary experience, and we were at the epicenter of the coronavirus issue. We understood the nature of the disease. We understood the nature of how hospitals run.
We are at Northwell Laboratories today. This is one of the most sophisticated labs in the United States of America.
COVID was a difficult time for New York. I'm proud to be a part of Northwell Health, where we cared for more patients in New York than any other health system.
We were an epicenter to treat the illness, but we were also a nationally recognized place through which new information arising out of how we treat that disease at this time emanated to a large degree from this health system. So we were constantly evolving.
We had everything we needed, PPE, ventilators. We watched people function as one, and I never saw anything like that.
I get a phone call, can you be here on Tuesday? We need you to start. And I'm like, well, I'm in St. Louis, I gotta pack my car and drive. And so it was really amazing, the resources and the capability, you know, and I couldn't have felt more welcomed. I realized I was in a system where I felt I was being taken care of under really difficult circumstances. But then once the dust settled, then it felt like a health system I wanted to stay and be a part of.
Northwell was able to hire 140 additional physicians. We added 1,200 ICU beds, and that wouldn't have been possible without the collaboration that Michael Dowling had with Governor Cuomo as we went through this, difficult time.
Northwell is leading the parade on this. Thank you from the bottom of my heart and on behalf of all New Yorkers for what the people at Northwell have done.
I was on staff at Washington University in St. Louis. I was on staff almost 15 years at Johns Hopkins. Northwell provided a palette to allow me to create something different and something new, to get better results in research, better results in clinical care.
I always felt working with Northwell was the pinnacle. I felt that they had access to the most cutting-edge technology, that they cared about patients, that they cared about their staff, that they cared about their doctors and their nurses and their employees.
Northwell is inherently focused at the physician's needs and to practice well and provide the care for your patients. And that is the priority. Everyone is committed to that.
You can rest assured that by joining this health system, you're going to be involved in the future of medicine.